So here I'm just going to review this interview. This was from a medical economics journal, but this is an interview with a Mark Murison, MD. He's a CEO of a company called Signature MD. So from my understanding, this company offers somewhat of like a franchised concierge medicine practice over different locations. So basically, they'll contract with different physicians, physician's assistants, or nurse practitioners to offer primary care using this concierge model. But let's go into this interview a little bit. He addresses some of the questions that I have with this research, with my research topic. So first, he talks about the current healthcare systems and how he feels that patients, in some cases, are the last consideration in our current system. He discusses how businesses should be responsible to do a few things, which he describes as providing great value. They should be convenient, it should be easy, simple, and deliver an experience that's effective. And he feels that in today's healthcare system, we're not doing that. What he believes is that there's opportunity to do a lot better, which he later describes through the lens of concierge medicine. He describes how these membership-based models open up the possibility for patients to have more time with the doctor, which is going to be like one of the primary benefits, is that by having these reduced patient loads, every interaction, every appointment is going to have the opportunity to be more in-depth and more personalized, as opposed to, let's say, like a 15-minute routine checkup. Or at least it gives patients who may want that or may need that the potential to have that benefit. And then he talks about not necessarily needing a full concierge practice. He describes what's called a segmented model, which would allow for sort of a mixed model. So there would be, patients could either opt into or opt out of the concierge program depending on their specific needs. And the doctor would be able to, or, a provider would be able to sort of delegate some of the non-concierge roles to different physician's assistants or nurse practitioners to maintain the relationships with whatever patients were not wanting to transition to a concierge practice. Again, he addresses that one of the primary concerns is that these providers are dealing with a lot of burnout, where they're overworked and overloaded with patients, and that this concierge model allows them to slow down and have a more detailed and focused relationship with each of their patients. He describes it as being able to practice medicine the way they were taught in medical school. And then he states in his own experience, one detail that is telling in favor of concierge medicine is that 90% of his patients are returning to renew their memberships each year.